The medical term for what we're about to talk about is hyperhidrosis. And in reality, it really means it just can't stop sweating. And now there's a new treatment that actually stops the sweat for up to a year. And you see everybody in front of us, and I'll explain this in just a minute. Joining me now is dermatologist Dr. Eva Shamban from Beverly Hills. And Dr. Shamban is joined by our patient, who is Dr. Ben Emanuel. And Dr. Emanuel, you are a critical care neurologist, right?
Correct.
And you are the patient today.
Yes.
Let's start with your hyperhidrosis. Tell us about it.
Well, you know, sometimes you get very sweaty, and it can affect your shirts because a lot of common deodorants have aluminum in it, and you get your work shirt stained yellow or white t-shirt stained yellow, and you get nervous. And the kind of job I do, we do a lot of acute strokes, bleeding in the brain, and a lot of what we do is high intensity acuity, and it gets stressful, and so this is something that you don't really want to happen.
My son has hyperhidrosis. When he plays video games and does his homework or whatever, he has to have a dish towel so that he can constantly wipe his hands off. Does it affect your hands or just your underarms?
No, it just affects my underarms.
It's extremely common in the underarms, and probably up to 17% of Americans have this condition.
Really?
And yes, and of course, you don't want to show that you're sweating or that you're nervous if you're doing critical care, or if you're going on a date, or if you're going to a job interview.
Well, so my son's even
or the red
worse
carpet,
because he's got it in underarms, feet, and hands.
Well, right now we have this wonderful new technology.
Yeah, I was going to ask about this. How new is this?
Yeah, this is just out in the last few weeks, and it's called Miradry, and it actually uses microwave technology to destroy the sweat glands.
So, Dr. Shamban, tell us what you've already drawn on Dr. Emanuel's armpit.
So what we've
Underarm. Sorry about that, Doc.
You can actually see some beads of sweat here. We haven't done the procedure yet. I'm the good doctor here. But what we've done is a grid which will guide the placement of the device so that we nab every single eccrine gland.
And this device is specifically for underarm
Yes,
sweat
unfortunately
glands.
You can't use it on the hands or the feet.
Or on the upper lip, you told me.
Or on the upper lip,
right.
Yes, on the upper lip. But I was thinking about broadcast news.
Exactly. Albert Brooks.
Albert Brooks, yeah, really sweating. But the other great thing about this device is not only does it take out the eccrine glands for up to a year, but it also takes out apocrine glands, which are the glands that make the odor. So a lot of people who've had other procedures, such as Botox injections, still would have odor. But that's what the grid is for. It's so we know the placement of the machine.
Does it heat? What does it do?
Yes, it heats. The eccrine gland is a very large structure in the skin. It's very deep. It's all the way down in the fat, and so all of the technology we've had to date has not been able to get to that depth in order to get to destroy these glands.
Now, you haven't actually done this on Dr. Emanuel yet.
No, we're planning. It's happening tomorrow. He's just here to show us what it's going to be like.
And we hear it's going to hurt. How much is it going to hurt?
It's not going to hurt at all because he's going to have complete anesthesia. Complete anesthesia.
I'm not trying to make you sweat more or anything, Doc.
Yeah, no. Complete anesthesia. Just on your armpits, though.
Really?
Yes.
So it's like a local or like a numbing gel?
No, injections. This needs injections.
All
but
right.
extremely effective.
And the cost is about $2,500?
$2,500. You need 2 treatments separated by 3 months, and then you have about 90% sweat reduction.
Does that mean $5,000?
No.
Oh, $2,500 total.
Yeah.
And does it leave you scarred or?
No. It doesn't affect the skin at all.
No.
Not at all. A little bit of swelling, which we take care of, and voila.
All
Fantastic.
Right. Dr. Shamban, thank you very much. And by the way, Dr. Emanuel, Ben Emanuel has been such a good patient because when he came in to lie on the table broke. So the reason he is not moving an inch, and the